Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Dear parents, autism is an incredibly important and sensitive subject that truly deserves our heartfelt attention and understanding. Navigating the journey of autism with your child is both unique and deeply personal. As parents, we understand that this path can sometimes feel overwhelming, filled with questions, emotions, and moments of uncertainty. It's a journey that requires patience, understanding, and unwavering love. We want you to know that you're not alone in this. Every child with autism is a beacon of individuality, resilience, and beauty. And as you embrace this path alongside your child, you are creating a world of endless possibilities and boundless love. Together, let's walk this journey with compassion, empathy, and a shared commitment to celebrating every milestone, big or small, as we support our children to shine brightly in their own unique way. Welcome, everyone. I'm Dr. Soumya Saluja from THIP Media, and today we will be having this crucial discussion on autism with Dr. Priti Mhatre, who will help us explore evidence-based strategies for enhancing health and overall well-being for these exceptional children and their families. Dr. Priti Mhatre is a compassionate and a dedicated developmental pediatrician with a mission to improve the lives of children facing neurodevelopmental challenges. With a rich background in pediatrics and specialized training in developmental neurology, Dr. Mathre brings expertise, empathy, and holistic approach to her practice. She presently works at MRR Children's Hospital as a consultant developmental and behavioral pediatrician, providing comprehensive care to children with developmental difficulties. Additionally, Dr. Mhatre is the driving force behind Tender Kids, the Center for Child Development in Navi Mumbai, where she leads a multidisciplinary team in providing early diagnosis and intervention for children with neurodevelopmental disorders. Her commitment to advancing pediatric care is evident in her research contributions, national publications, and active engagement in educating parents and healthcare professionals. With a strong digital presence and a passion for integrated care, Dr. Priti Mhatre is dedicated to shaping a brighter future for children with developmental challenges. So Dr. Priti Mhatre, THIP Media welcomes you, ma'am.
Hello.
Hello, ma'am. And ma'am, as we all know, that autistic children, they have very distinctive needs, as far as their overall well-being is concerned. So I'm going to start off this discussion with the most fundamental question, that what is an autism spectrum disorder, or ASD?
Okay. Thank you for this wonderful platform.
Thank you so much for joining us, ma'am.
Yeah. Autism is a complex neurodevelopmental disorder in which children faces challenges in social interaction, communication, and they may have repetitive or restrictive interest or behavior.
Okay.
Why is it called spectrum? Because it may present or manifest differently in each individual, and the severity also differs from mild to severe.
Okay, right, ma'am. What are some of the earliest signs that might indicate that a child could be on the autism spectrum?
On an average, autism is been diagnosed around 2 to 2.5 years of age,
right,
with main concerns of speech delay.
Okay.
But as we have earlier seen, this is a social communication concern. So even as early as less than a year or in a toddler age, we see a lot of concerns pertaining to social interaction and communication. So what are these signs? First is less eye contact, no social smile. They seem disinterested in others, like to stay aloof, not a typical toddler behavior. They are where they are
Right.
all over you.
Right.
They might not respond to voice, sound, or when you call them by their name.
Okay.
They might show a repetitive actions like flapping hands or bouncing, or they might have an high intensive reactions to loud noise. They might avoid certain taste textures. So some certain sensory differences are noticed.
Okay. Right. And could you help us in understanding that as a doctor, how would you diagnose autism? And in this, I mean the specific criteria and assessments that are involved.
Autism spectrum disorder is basically a clinical diagnosis. So
Right.
a formal evaluation by an experts like developmental pediatrician is needed, where
Right.
they take a detailed history from parents and caretakers.
Right.
They observe a child in terms of behaviors, their social skills, communication skills. They assess the developmental milestones of these children,
Okay.
and there are few standard tools which are being used to diagnose. The first is DSM-5 criteria for autism spectrum disorders. A DOS scale is being used, and CARS.
Okay. And since you've been mentioning that, you have to communicate and converse with parents, who bring in the children to a developmental pediatrician. So, what is the most common mistake you have seen parents doing when trying to deal with an autistic child?
It is expecting a child to confirm the typical socially accepted behaviors. So
Right.
acceptance is something which gets delayed, due to which the
Right.
intervention has been, been delayed, and hence it affects the child's overall functionality in future. So as a
Oh,
parents, accepting the child's unique needs, and taking help of professionals and working towards the well-being of child is the most crucial thing when dealing with these kids.
okay. And we just had this discussion that, parents also taking time in accepting the behavior of their children. So I'm sure there must be some misconceptions associated with autism. So can you help us understand, the facts that could debunk these myths or misconceptions?
There are many, but at present today I'm going to discuss two more main important misconception. One is autism spectrum disorder is equivalent to intellectual disability.
Okay,
Many a time parents feels that the cognition is low, due to which they are unable to learn the skills which a normal, a neurotypic child learns. So
okay,
here, the cognitive ability of autism spectrum disorder is of varied spectrum. It can be from low cognition to higher cognition. That's why we see a summon skills where, they are excellent in certain fields, and they have a very, high-end abilities to perform certain tasks which even we are unable to do. And
right.
the second most common misconception is this: the children with autism spectrum disorder cannot go to regular school. Okay,
Okay,
so autism spectrum disorder per se isn't criteria for child to opt out from a regular mainstream school, especially after Right to Education Act. You know, it's well recognized condition by all educational board across globally. There are various recommendations and accommodations been established and been advocated to be utilized in a regular stream schools, which nowadays schools are becoming more and more inclusive. So
right.
for a parents, try to utilize those accommodations and modifications, and see whether with this modification child is able to adjust with the main school and cope up with the academics. Only if they hit a block in spite of all these things, they can opt for a homeschooling or special schooling mode.
Okay. And since you've said that autistic children, they find it a little difficult, in socializing with other kids, and which is not really a very common behavior, which is not very normal. considered to be normal, rather. So, how does autism impact various aspects of communication and social interaction? And I mean it in terms of challenges that they might manifest, differently across the spectrum.
So autism spectrum disorder, the core concern is social interaction and communication issues. So in
Right.
terms of communication, there will be a delay in development of speech and language. They are unable to understand non-verbal cues. They are unable to initiate or sustain conversation with others. In terms of social interaction, they might be not interested or might be not, facing concerns while making friendships with others. Understanding the normal social norms and expected behaviors in certain situations are the certain challenges which they face in routine.
Okay. Right. And with specific difficulties, these children, they're undergoing, particularly in their educational settings. So, what strategies or accommodations can be implemented to support their learning and inclusion?
There are various challenges the spectrum kids faces in a routine classroom setting. So first is communication challenges where the child is unable to understand instructions given by teachers because of the varied capacity of understanding the language what we speak. In that situations, teacher can break down instruction into small steps or can use visual schedules or visual pictures for help them better understand the academics or studies. Second is they might have a sensory differences which may impact their attention skills or their performance in the classroom setting. So knowing their differences in a better way and helping or making certain changes to make a sensory friendly environment for this particular child will help him to stay focused in a classroom. Then there are other like social interactions. Social interaction forms a important part of a classroom. They do not have much interest or they pick up block at that time. Assisting them with a help buddy also helps them to have that social interaction in a classrooms. uh, and additionally, autism spectrum disorder has executive functioning concerns where organization skills, time management are the few of the concerns which they face, due to which they have a underperformance in academic areas. In such condition, individualized educational plans help. And during the board exams, there are certain accommodations which are been given to these kids in form of opting for vocational subjects, extra times, reader and writers. So this is how we can help them in a school setting.
Okay. And because autism is a spectrum disorder, so it means, there are different symptoms and treatments for each case. So in such a case, parents of autistic children, they cannot even learn from each other because every case is so distinctive. It could be so unique. So how should one approach a child in such a case?
Even though the child is unique, talking to other parent helps them immense by sharing the experiences, strategies, resources, give lot of it will be a lot of help for other parents. Then having a collaboration with professions and supportive groups can give lot of insights and help feel supported throughout this life journey.
Okay. And in what ways can technology be harnessed, to enhance the lives of children with autism?
Technology is life-changing for everybody, but pertaining to autism spectrum disorder, right from skill building. So there are various apps which are being used for skill building like vocabulary,
Okay.
practicing certain social skills.
Right.
Then there are certain kids who are non-verbal. One-third of kids do understand language, but due to certain motor concerns, they are non-verbal. In such cases, the technology in form of iPads, voice notes help them to form an alternate or augmented form of communications. Then there are certain wearable devices which has a tracking device which
Okay.
ensures safety and well-being of these kids. And with AI coming, there are certain variables which are devices which are developing, which helps this kid understand not only their but other people's emotions
Okay.
appropriately, and hence we expect that the social connections will boost with this kind of devices.
Okay, that's wonderful to know. And what holistic measures, can be implemented to foster the self-confidence and overall quality of life for children diagnosed with autism?
Okay. So here, basically, as a parent and as a child, utilizing the various therapies like occupational therapy, speech therapy, behavioral interventions to build up the skills and to
Right,
support the challenges in various
right.
domain forms the first line. And as a
Okay,
society, we have to be more inclusive,
okay,
foster their uniqueness,
right.
support their strengths,
Okay,
giving them equal opportunities to form a meaningful social connections, and fostering their independence
right.
is the main key for them to feel supported.
Okay. So that was very, very insightful, Dr. Preeti. And we are very grateful for your presence today with us, ma'am. So thank you so much for joining us today. And I'm really hoping that this discussion would promote empathy, knowledge sharing, and cooperation in our shared goal of giving autistic children a compassionate and successful management.
Yeah. Thank you.
So thank you so much for joining us again, ma'am. And for more such informative videos, please subscribe to our channel and press the bell icon for regular updates. Thank you once again.